Hi everyone, this is Himaja Senior Nutritionist from Wilson's Health Community. So in just 10 seconds, a brief transformation story of mine. So you can see on the screen, with the help of Wilson's community who were working on a vision to eradicate diabetes, I have successfully reversed my 20 kgs of overweight. So from 88 to I have come down to 68 kg, and even I have reversed my diabetes, type 2 diabetes as well. So from 8.7, it has come down to 5.3 in 4 months of time. And even successfully, I have reversed my PCOD issues and disc bulge and arthritis issues, guys. So this is all about me. So on the occasion of Women's Day, so I am here to share with you all, guys, what this PCOD and infertility is all about and how women can easily reverse it, okay, through diet, and how even I have reversed my PCOS issues as well, guys. Okay. Yeah, here infertility is visible on the screen, guys. Okay, so first, in order to understand about female infertility or PCOS issues, so first we need to understand what are the symptoms to show that a woman is suffering from PCOS issues. So the first thing is hair fall. Okay, so large amounts of hair fall would be there, and next facial hair, not only facial hair and hair at unwanted parts in the body as well. Okay, like unwanted hair on different parts of the body. Okay, and next pelvic pain, having so much of pain before periods, after the periods, and during the periods as well. And next pregnancy related issues, unable to be conceive. And next weight gain. Okay, so they will be putting on the weight easily. And next irregular periods as well. Okay, so either scanty periods or long periods, regular periods. So they will get periods before 10 days or 15 days. And sometimes they won't get the periods even after 2 months, 3 months, or 6 months, or 1 year. Okay. And in some cases, even 2 years also. Okay. And next, acne. So a lot of facial acne. So these may be the symptoms to show that a woman got affected by PCOS. And what are the reasons behind it? So a woman can be either in underweight or overweight, or they may be suffering from hypothyroidism, because of which they will become overweight, or even hyperthyroidism, because of which they will go into underweight. Okay, and having improper gut health, having lots of stress, having lots of cortisol hormone levels in the body, and lack of sleep, not having 6 to 8 hours of sleep in a day, and lack of proper nutritious food, and lack of some nutrition in the body, and prevailing insulin resistance in the body. So these may be the reasons. Okay, so now in brief, just even like a layman can understand, I will explain you about the female reproductive system. So this is female reproductive system. This is uterus. Okay, and inside endometrium layer will be there. Okay, and these are called as fallopian tubes, and these are called as ovaries. So any woman by birth, she will be born with 2 lakh eggs. So out of this 2 lakh eggs, every month what happens is, for example, we will take 200 eggs are going to release, and these 200 eggs will start to grow into follicles. Out of these 200 follicles, only one follicle will be grown completely, and we will call it as a dominant follicle. So now this dominant follicle, when completely grown, it will release the egg. Then what this fallopian tube has to do? It has to come closer. It has to collect the egg from the ovaries. So then what happens after this? With the help of hair-like structure called as cilia, through this fallopian tube, this matured egg is going to travel. And after traveling, what happens? It will reach the endometrium layer. So in this process, if fertilization happens, so zygote or embryo will be formed, and it will stick to the endometrium layer, and baby will be born after completing 9 months and in the 10th month. So if fertilization doesn't happen, it is going to shed away, and we will get the periods. Okay. Then what about these remaining 199 follicles? They need to dissolve automatically. So in some cases, what happens is they won't dissolve. So when they are not going to dissolve, what happens? Ultimately, they will start collecting water from the nearby area, which we'll call it as a water cyst, or they will start collecting blood from the nearby area, which we'll call it as a chocolate cyst. And hence cyst formation will be started. So here in the diagram, you can see this is a normal ovary, and this is an ovary with multiple cysts in it. Okay. So now here you would have understood the difference. So for a woman to get regular into these periods, this also may be one of the reason formation of cyst. So we need to come out of this condition. So reversing insulin resistance in our body is going to help to reverse all these health issues. Okay, and for women to become infertile, so many things or reasons may be there. So the first thing is this formation of follicles may not happen properly, or the release of egg may not happen properly. Even though both these two are happening, there may be some problem in the fallopian tube, some blockages or something. Okay, or the next thing is like the strength of the endometrium layer and uterus will not be up to the mark, so that it may not be able to catch hold of the baby. So this problem also can be there. Okay. So here in all these steps, we need to understand where the major problem is occurring and we need to correct it so that a woman can become fertile. Okay. So not all these things will be revealed in the reports. So some may be the symptoms, and mainly the health part, definitely it will not be revealed in the blood test reports, because blood test reports are something which are going to tell us only the parameters or numbers. Okay. And next, when coming to male infertility issues, so the factors that will concern a lot is about the count. Okay. So the sperm count should be greater than 15 million per ml, and progressive motility has to be greater than 32%, and morphology should be greater than 4%, and pH value, okay, of the semen has to be greater than 7.2, and liquefaction should happen in less than 20 minutes, and fructose levels have to be greater than 1.2 milligram per ml. Okay. So here we can see different motility stages and different morphologies. Okay. So the morphology has to be normal. Okay. So for this, what generally people will do for reversing these female and male infertility issues, they will go for conventional treatments like medications and injections, or fallopian tube transfer. Okay, almost it may cost, at that time it was 14 lakhs, now it's would have been still more. Okay, and even IVF cycles, it will cost per cycle to end of 2.5 to 3 lakhs almost, and IUI cycles will cost 3 lakhs per cycle. Okay, and ICSI almost it will cost 2 lakhs per cycle. Okay, so why male are getting into these issues? So again, the same thing, like they can be into hyperthyroidism under or overweight, and excessive heat in the environment where they are working, and lack of proper nutritious food, and lack of sleep, drinking alcohol or having more of tea and coffees. Okay, and having smoke habit and taking drugs. Some people will be having some infections like HIV and all. Okay, and also some physical damage when they are, being a sports person and all, or due to any accidents that have happened. Okay, and physical damage because of that, and main root cause being insulin resistance. Okay, so these all may be the reasons why a male is getting into these infertility issues. So now what has to be done? Okay, so again we will discuss about the common causes. Okay, so high carb diet, so taking carbohydrates more than that is required for our body. Okay, so what should be the reversal thing? Being in a low carb diet, that means how much carbs is required for our body, only that much we need to have. And next, we need to avoid multiple eatings, and we need to be into intermittent fasting, and protein intake will be low. That is also one of the major cause. So how we can rectify it? So ideal protein intake of 1 to 1.5 grams per kg weight of our body, or it even differs from person to person. So basis World Health Organization recommendations. Okay. And we need to have one exclusive fiber meal, and we need to take vitamin and mineral supplementation wherever we have some vitamin and mineral deficiencies, like vitamin B or vitamin D or folic acid or multivitamins. Okay. And expert workout sessions on reversing PCOD and infertility issues, if at all they are happening in your area, or with any online yoga or meditation practitioners, you can join them as well. Okay. And the next thing is, we believe in this optimal health. So already we have discussed this in our weight loss awareness session video. So mental health and physical health. So positive mental attitude, that definitely will be able to reverse this PCOS and infertility issues. Okay, if at all there are no structural defects by birth in it. And next, having adequate rest, 6 to 8 hours of sleep in a day. Okay, and you need to be in that positive mindset that yes, we have Miss Himaja from Wilson's community this time, who is going to help us in reversal of all these health issues. Okay, and next, having a proper physical exercise, which will help us to reduce cortisol hormone levels in our body. And next, having proper food and nutrition. This is the part where I am going to help you guys. But for me, in order to help you, it doesn't happen just like that. So I need to understand some details from you. First is your BMI, your age, height, and weight details. And next is your HbA1c levels. That is the blood glucose average of last 3 months. And next, the lipid profile. Okay, the complete LDL, low density lipoprotein, high density lipoprotein, what are your cholesterol levels. Okay, and next your thyroid profile to check your T3, T4, and TSH values. And next hemoglobin, if any deficiency is there. And next your latestly taken semen analysis report and any abdominal scan in case of ladies that has been done. Okay, so abdomen scan report and next hormone test that generally we check like testosterone treating infertility cases. So what all hormone test is required. Okay, so you can get in touch with me so that I can let you know what are the hormone tests that you require. So once we are ready with this blood test and the reports pertaining to you, definitely I can suggest you a customized diet plan. So which is going to help you to reverse your PCOS and infertility issues. So for further inquiries and consultations, you can approach Healthy with Himaja. Okay, so this is my Insta, Facebook, LinkedIn, and YouTube ID as well, guys. Feel free to WhatsApp me. So definitely I will be reachable to you guys through WhatsApp and I will be helping you to reverse your health issues. Okay, so stay fit and stay healthy. Bye-bye.